Let's start today's lesson on osteoporosis. Osteo refers to bones and porous means pores. So, osteoporosis is when there is a higher breakdown of bone in comparison to the formation of new bone, which results in porous bones, meaning a decrease in bone density to the point of potential fracture. I have placed a short video in the supplemental material on D2L, which further explains the pathophysiology of osteoporosis. Osteoporosis can occur at any age and in both men and women. However, 80% of those with osteoporosis are older women. There are two types of osteoporosis: primary and secondary. Primary may be either type 1 or type 2. Type 1 is associated with menopause, and type 2 is associated with decreasing bone formation that accompanies the aging process. Type 1 has been linked to estrogen deficiency, resulting in a decreased calcium reabsorption from the bone. Type 2 typically results as the kidneys lose their ability to process vitamin D, causing a decreased calcium absorption. Secondary osteoporosis occurs because of a disease process or a deficiency, or as an effect of a drug. Renal hypercalciuria is one of the more common causes. So, what is renal hypercalciuria? Well, that's the loss of calcium in the urine. So there's an issue with the kidneys there. Many patients with primary osteoporosis also have one or more secondary factors, such as Cushing's disease, and you'll learn more about how Cushing's creates this osteopenia or osteoporosis. Adrenal insufficiency, again, we'll talk more about that in our classroom lectures. Calcium deficiency, or diabetes mellitus. There are some medications that increase the risk, and they are heparin therapy, the antiretroviral therapy, and so you're learning about age and HIV and your autoimmune. So again, those medications put people at risk for osteoporosis. There are some psychotropic and chemotherapeutic drugs, and furosemide is another one that you want to be cautious in. The risk for developing osteoporosis depends on how much bone mass is achieved between the ages of 25 and 35, and afterward, how much bone mass is lost. Unmodifiable risk factors include being female, thin, and/or having a small frame. A personal history of fracture after the age of 50 is also a risk factor. In women, age-related bone loss begins earlier and proceeds more rapidly, beginning in their 30s, and accelerates after menopause. Age-related bone loss also occurs in men, but it's 15 to 20 years later than in women, and at a slower rate. Estrogen in women and testosterone in men appear to help prevent osteoporosis. Osteoporosis is more common in Caucasians and Asians, and those with a family history are at an increased risk. Prevention focuses on the modifiable risk factors. Dietary intake plays an important role. Calcium is an essential mineral in the process of bone formation. When the intake of calcium is insufficient, the body compensates by removing calcium from the skeleton, weakening the bone tissue. A high intake of diet soda with a high phosphate content also depletes calcium stores. So you probably remember that from your lecture on electrolytes in 180, that calcium and have an inverse relationship. Vitamin D is essential because it facilitates calcium absorption from the intestines into the blood. For most individuals, 10 to 15 minutes a day in the sun is usually sufficient to get your vitamin D, but some individuals require food or supplemental sources of vitamin D. Acidosis from those high protein diets, right? The ones where you just eat meat and you stay away from the carbs, they contribute to osteoporosis in two ways. When you're acidotic, calcium is withdrawn from the bone as the kidneys attempt to buffer the acidosis, and that directly stimulates osteoclast function, which means it stimulates the breaking down of bone. Individuals with a body mass index of less than 20, regardless of their sex, their age, or their weight loss, are at risk. Low body weight causes the body to stop producing estrogen. Cigarette smoking decreases the blood supply to the bones. It slows the production of the osteoblasts and impairs the absorption of calcium. Heavy alcohol use also has a toxic effect on osteoblast activity, suppressing bone formation during periods of alcohol intoxication. And those who are heavy with alcohol abuse, they're often accompanied by nutritional deficiencies. Weight-bearing exercise, such as walking, causes an increase in blood flow to the bones, which brings growth-producing nutrients to cells, and walking also causes an increase in osteoblast activity. Osteoporosis is called the silent disease because in the initial stages it may produce no symptoms. The presence of a fragility fracture, that's a fracture that occurs from a mild impact, may be the first sign. Common manifestations as you progress through the disease process include fractures, back pain, loss of height, and a stooped posture. Vertebral fractures may cause a loss of height, back pain, functional limitations, and spinal deformity. As the vertebral bodies collapse, a forward curve of the spine and an excessive inward curve of the neck produce a spinal deformity. You see this hunched appearance. It's also called a dowager's or a buffalo hump. This results in back pain and a protruding abdomen, making daily activities such as eating and sleeping difficult. Dual energy X-ray absorptiotomy, or a DEXA scan, measures bone density by passing a high and low energy X-ray beam through the body. Usually it's done in the hip area and in the spine, and it's considered highly accurate. And the reason why they choose the hip and the spine, because that is two of the three areas where you see those fragility fractures most commonly. The other area would be the wrist. The DEXA scan reports T-scores of the standard deviation above or below the mean for healthy young individuals. If your T-score is a 1 or higher, your bone is healthy. If it's a -1 to a -2.5, you're diagnosed with osteopenia, which is a less severe form of low bone mineral density than osteoporosis. If your T-score is a -2.5 or lower, then you're diagnosed with osteoporosis. Pharmacology is used for prevention and treatment of osteoporosis. So on the chart in front of you on this slide, I have two drug classes, the selective estrogen receptor modulators, which are the SERMs, and then I have the bisphosphonates. These are the only two classes of medication that I will be testing for and that you're responsible for. So let's start with the selective estrogen receptor modulators, the SERMs. So how do they work? Well, they prevent bone loss by mimicking estrogen's benefit on bone density, and they're given to postmenopausal women who have lost that healthy estrogen. They're really at high risk for blood clots. You want to take it with calcium and vitamin T, and that doesn't mean concurrently, that just means that you should be taking those in addition to this medication. Hot flashes are a common effect. You want to avoid cigarettes and alcohol when taking it, and just know that impaired thinking or judgment may occur. So it used to be that postmenopausal women were very quick to get on these medications, but the increase in blood clots has kind of waned the use of these meds. The bisphosphonates, and that's what you're usually going to see nowadays with patients. And again, they're used for the prevention and treatment. So a patient who is diagnosed with osteopenia may be placed on this medication as a preventative measure of going to an osteoporosis. So under the classification, I have several drugs that you may recognize from television commercials. But the mechanism of action is that it inhibits bone resorption, which is breakdown. It preserves bone mass and increases bone density in that hip and the vertebrae, those two areas where bone loss is seen most often. Remember, you don't want to take these medications if you have a history, especially women, of blood clots. Take it on an empty stomach first thing in the morning with water because it's very caustic to the esophagus, the GI tract. So after the patient takes it, you want them to remain upright for 30 minutes, and you don't want them to drink or eat anything for that 30 minutes, and that's to avoid the esophagitis. If they're taking supplemental calcium and vitamin D, which they should be, you want to hold them for 60 minutes or longer. And again, as I said, it's caustic to the GI tract, so you want to monitor for those GI effects, the esophagitis, and again, we want to monitor kidney function. There is a rare and a serious adverse effect, and that's that osteonecrosis of the jaw and subtrochanteric fractures of the femur. So the use of these medications more than 5 years increases the risk. So since the therapeutic effects of this medication seem to continue after therapy is stopped, means it remains in your system, a holiday is recommended after 5 years for those taking oral bisphosphonates. So what is a holiday? That means they take you off of that medication and give your body a break. Moving on to the adjunct pharmacologic therapy. Calcium gluconate and other calcium compounds are used to treat and prevent osteoporosis. Oral calcium supplements are best taken between meals or within 1 hour following meals. So you don't want to take it with meals. The most common adverse effect is hypercalcemia, and that's caused by taking too much of the supplement. Symptoms of hypercalcemia, as you recall from NUR 180, include that lethargy, drowsiness, weakness, headache, anorexia, nausea and vomiting, increased urination and thirst. Caution, patients who are taking digoxin or tetracyclines and calcium channel blockers, you want to watch your dosage. You don't want to give them both of those medications and not be thinking about that hypercalcemia. A diet rich in calcium and vitamin D can help improve bone strength, and as you saw from the pharmacology, calcium and vitamin D are supplemental medications that you take. Calcium-rich foods include dairy products, your green vegetables such as broccoli and curly kale, fruits such as oranges, apricots, and dried figs, canned fish with soft bones, and nuts. Calcium-enriched foods are also available in such items such as bread and cereal and orange juice. Vitamin D, as I said in a previous slide, can be obtained from sun exposure, but we do have those people who don't absorb the vitamin D from the sun, so they require supplements and they require eating foods high in this vitamin. So vitamin D can be found in oily fish such as salmon, sardines, mackerel, eggs, liver, and those vitamin D fortified foods. Some nursing considerations include promoting a balanced nutrition and relieving acute pain, encouraging exercise, and promoting healthy behaviors. We pretty much touched on all of these categories of the nursing considerations. For further information, review Pearson, pages 858 and 859. And this concludes our mini lecture on osteoporosis. Nursing considerations include promoting balanced nutrition, relieving acute pain, encouraging exercise, and promoting healthy behaviors. And we pretty much touched on all these categories of nursing considerations. For further information, review Pearson, pages 858 and 859. And this includes our lecture on osteoporosis.